All right. So why is prenatal care so important? So prenatal care is like of the utmost importance to our pregnant moms because it first of all promotes the maintenance of healthy choices and lifestyles during and after the pregnancy as well. And we will talk about the importance of postpartum care in this presentation as well. It also promotes healthy moms and babies, which leads to a healthy pregnancy outcome. It helps to reduce the risk of complications during pregnancy and prevents problems during delivery. And it also helps to recognize any abnormal signs or symptoms during the pregnancy that can alert us that something is going on. So we usually try to go over those things with you at each visit, and especially towards the end of the pregnancy. We go over any signs or symptoms of preeclampsia. We also go over things like if you're having any heavy bleeding, if you are not feeling your baby move, things of that nature. We tell you to go to the hospital. Don't wait to call Friend Health. Don't try to get in contact with me or your provider. Go ahead if you have any questions regarding your pregnancy and go to the hospital. So important. Prenatal care is also very important because it improves healthier birth weights for infants. We try to catch things like IUGR, which is intrauterine growth restriction. We try to catch that, and we do that by getting you the ultrasounds that you need. We also will measure you at each visit, starting at about 20 weeks. And that we do that to make sure that the measurements correspond with how many weeks you are pregnant. And if it's not measuring up to par, then we will actually send you in for an ultrasound to get the baby's weight and to make sure the baby is growing efficiently. And if not, then we will continue to monitor the baby really closely inside, as well as the blood flow from the mom to the baby. And if there are any problems with that, then we will further probably schedule you for an induction. Sleeping. We want moms to know that it is okay to be a little more tired during your pregnancy. It's expected. You're actually growing an entire human being. So we know that you need a lot more rest. So it's okay to feel like you need more rest during the pregnancy. Don't feel like you're lazy or that you're not functioning up to par. It takes a lot of work to grow a baby. So you want you to know that that is normal. Um, it also promotes good hygiene. So, when you're pregnant, you gain a little pregnancy weight. It's okay if you have to take an extra shower or drink a lot more fluids to stay hydrated. You will sweat a lot. Some pregnant women have a lot of sweating, especially this time of year. It's starting to get hot outside. So please take your water with you wherever you go. If you need a little extra deodorant, if you need an extra shower, it's okay. It's all right. Also, eating. We want you to healthy eating habits, like hopefully for life. So during your prenatal visits, we'll ask you, how are you tolerating your meals? Are you having any nausea and vomiting? Um, are you eating a healthy iron rich diet? Are you taking your iron pills? I know my patients are tired of me talking about that. Are you taking your iron? And even when you come in for your initial visit, we will ask you, do you have prenatal vitamins? We usually prescribe those at the first visit. And some patients, I'll ask them if they have a history of anemia, we'll go ahead and prescribe iron, like at that point, at the first visit. Um, Also, we know that you're developing a growing baby inside of you, and it helps for moms to recognize like signs and symptoms of any problems like I said before. All right, so during the first visit, we will check your blood pressure, we check your vital signs, we check your height, we check your weight, we check your urine. Um, those are things that we do for a reason. And I know a lot of my patients, when they come back in, they're like, oh gosh, I have to give another urine, or why do I have to come back so frequently? And so there is a method to our madness. So we check your blood pressures to make sure that you don't have any hypertension. We also check to make sure you're not developing any complications such as preeclampsia. We check your weight to make sure that your baby is developing, that you're growing appropriately and gaining the appropriate amount of weight during each visit. And we check your urine. Your urine, we check for protein. We check it to make sure also for any white blood cells or nitrates to make sure you're not getting a urinary tract infection. And we check that at every visit. Yes. So we are looking out for you and your baby. Don't think we're crazy, but yes, we are looking out for you. We perform a thorough health history. And we want to make sure that you're honest with your provider. We're not trying to be up in your business, but we are trying to take like the ultimate and the best care of you. So please be honest about your previous pregnancies, as well as if you have any complications or had any complications in the past with your previous deliveries. Tell us all about it. We want to hear about it. We want to promote a healthy outcome for both you and your baby. We'll also perform a pelvic exam as well as a cervical exam. At that time, we'll do a STD screen. We, of course, get labs, prenatal labs, and it can be a lot of labs. So make sure it's your first visit that you're really well hydrated, that you eat a lot. So we don't want you to pass out or anything when we draw your blood. We will prescribe prenatal vitamins, like I mentioned earlier, and sometimes iron. And we'll also address any questions or concerns that you may have. And that is a picture of famous Dr. Jackie. My patients a lot of times will say, you remind me of Dr. Jackie. But yes, Dr. Jackie is married to medicine, and she's the famous OB-GYN, and we will take just as great care of you as Dr. Jackie, I can assure you. Alrighty, so I thought this was the cutest ultrasound picture. Madison put that up for me. That is actually a baby smiling in utero, and we want all of our babies to smile and be happy as well. So at your next subsequent visits, like I said, we'll check your urine. So every time you come in, ladies, we'll give you that urine cup. The MAs do a great job. They'll check your vital signs. Hats off to our MAs. We love our MAs. They are our eyes and ears. They let us know what's going on with you before we even see you. So the MAs will ask you, and please be honest if you're having any problems or concerns. Also, they will take your vital signs, your blood pressure. They'll get your weight. They'll check your urine for us, and they are great help. We cannot do it without our MAs. So hats off to our MAs, and thank you very, very much for all you do. Also, like I said, they'll let us know if anything's going on with you. We review all of your test results and ultrasounds at your visit. And then the best part that I always tell my patients is the icing on the cake. We listen to your baby's heartbeat. And that's at 10 weeks and up. So once you turn 10 weeks, we can actually hear the heartbeat on our Doppler. And I was just talking to all of my patients are my favorite. So I'm going to say favorite patient, but you're all my favorites. And today, and I was like, the best part of the visit is when we can hear the baby's heartbeat, because I could just see like a sigh of relief when we heard her baby's heartbeat today. And I was like, even when I was pregnant and I would go to my prenatal visits, like I would listen to my OB-GYN, but it wasn't until I heard the baby's heartbeat that I could really like relax. And then I was like, oh, okay, now we can talk. So it is very reassuring to hear that heartbeat for both of us. At between 15 to 20 weeks, we will order the appropriate genetic screening tests. And genetic screening tests are very important because they tell us if you're having any possible like abnormalities with the baby. So we check for Down syndrome, We check for any open neural tube defects. So those are things that we really want to know about. We may send you for genetic counseling. Please don't be afraid. If we send you, it's just because we need more information, right? So we can take better care of you and your unborn baby. Um, we usually will send you to the University of Chicago. They have a phenomenal genetics department. If your insurance is unable for you to go there, we will find genetic counseling for you at the appropriate hospital. So don't worry, we will still take great care of you, okay? At 18 to 20 weeks, this is everyone's favorite. We'll order the anatomy ultrasound. Now, believe it or not, the anatomy ultrasound is not just for the gender, but it also gives us a lot of good information. So it tells us the gender, but it also, I usually tell my patients, it checks your babies from the brain all the way to the toes. So if there are any complications or anything going on with the kidneys or the heart or the bladder, or anything of that nature, it lets us know that so we know how to proceed. Also checks the weight of the baby. It checks the placental location. It checks for the fluid around the baby. So these are things that are very, very important that we all need to know, okay? All right, great. So here's a patient of me, a picture of me and one of my favorite patients. So you see I'm measuring her fundus and she's almost ready to have her baby. And yeah, we're really excited. She was measuring off the charts, but appropriately. And so it's very important that we do these measurements when you come in. We check your urine once again. We check your blood pressure. And so once again, these are things that we need to do at every visit, and it's very, very important. Between 24 to 28 weeks gestation, we'll order a 1-hour glucose test. Now, this is a very important test. It checks for diabetes during the pregnancy. And then I just had one of my patients today. I was doing her history, and she said, "Oh yeah, Nurse Knox, my mom actually had diabetes when she was pregnant with me, and she was 27, and she said now she's in her 40s and she developed diabetes." And I told her, "Oh my gosh, that is so, I'm not happy her mom had diabetes, but I'm happy that she brought that up," because I told her, yes, sometimes if you're positive for diabetes during the pregnancy, later in life, it's a possibility that you may develop diabetes. So very important, once again, that you share information with us. So for that patient, we will order an early glucose test for her. We also check your blood type again to make sure that you're not Rh negative. And if you are, we'll give you a RhoGAM injection. So RhoGAM helps if you have a Rh negative blood type. It helps to sustain the pregnancy and not cause any complications with the mom and the fetus. And we will also check you once you deliver, check the baby's blood type as well as your blood. We'll check the baby's blood type. If the baby's blood type is positive, then we will give you another shot of RhoGAM after you deliver. So just to know to expect that if you're Rh negative. It's not a bad thing, but we do look out for you and your baby, and the pediatrician will tell you your baby's blood type before you leave the hospital. At 32 to 34 weeks, we order third trimester labs. So those are usually HIV. We repeat it again. A syphilis test, we'll repeat your blood type, and then also maybe do another STD screen. We'll also discuss appropriate delivery options, whether or not you need a repeat C-section, or if you're going to attempt another vaginal delivery. We'll talk about the appropriate hospital for delivery, and that depends on your insurance. But also, of course, if you go into labor, and we want you to go to the closest hospital near you, okay? We try to go to the hospital that takes our insurance, but if you can't make it to the hospital, it's okay. Go to the nearest hospital, all right? We also talk about postpartum contraception, and that's birth control. Some patients opt not to get any birth control, but a lot of times patients, we like for you to start thinking about what type of birth control that you would like after you have your baby. And then the best thing, my favorite, is breastfeeding. So we love to promote breastfeeding. Breast is best. So this is actually why we have breast, is to feed our babies. It's all natural. And we all know we have a lot of questions about formula, right? Especially now with the formula shortage that's going on in America. Also, there are a lot of additives and preservatives that we don't know about. I'm just a pro breastfeeding provider, and I think that it is wonderful. And I'm sorry that there's a shortage, but I have noticed an influx of patients that are starting to ask a lot of questions about breastfeeding and that want to breastfeed their babies. So I think that that in itself is wonderful. And yes, breast milk, if stored in a regular freezer, is good for 6 months, and a deep freezer is good for a year. And that's without any additives or preservatives. That's just all natural breast milk. That tells you how good it is. Breastfed babies are smarter. They are have fewer ear infections. Their immune systems are more developed. Breastfed moms, my patient today, she breastfed her baby, her first baby, for about 4 months, she told me, and then she's planning on breastfeeding this baby a lot longer, especially with the shortage in the formula. But she was like, yeah, and my body just snapped right back after I breastfed. And I said, yes, very good. That is one of the benefits of breastfeeding for moms. So there are so many benefits to breastfeeding. Yes, it is hard work and it is tedious. I will not lie. I breastfed twins for a year and worked full time, but you can do it. It is such a good feeling to know that you're giving your babies what's best for them. So we make choices, and formula is quick and it's good, and not everyone can breastfeed, but most of us can. And I suggest that we at least try. Alrighty, so at 36 weeks gestation, once again, we'll perform another STD screen. So unless if you're having any problems with discharge, any odor, itching, tell us at any time and we will check you at any time during the pregnancy. But we will, if you're not having any problems, we usually check you at the beginning and then at the end. And then we'll also do a group beta strep test. So this is a swab that we perform at 36 weeks gestation and up. Group beta strep is a bacteria that's found in a lot of women's vaginas, but we really worry about it when you're pregnant. Some babies with group beta strep, they can develop complications later and after they're born. So we check all moms for group beta strep. If it is positive, then once you go in to deliver your baby, you'll let the OB-GYNs know, and they'll also check your chart. But I'll usually tell my patients, because I want you to be informed and I want you to know what's going on in your body. And so my patients, I know when they go to deliver, they tell the OB-GYNs that, yes, I have group beta strep, and Nurse Knox said that I need some antibiotics. So kudos to my patients. Keep up the good work. And if you're not sure about group beta strep, ask your provider. They will let you know. And you'll let your OB-GYN know when you go in to deliver. All righty. So we just give you IV antibiotics. It's not a big deal, but we like to know. And it's treatable. We go ahead and give you, like I said, IV antibiotics. You'll get an IV when you go in to have your baby. All pregnant women get an IV. It is for your safety. And so it's not like you're getting an extra IV or we're doing anything extra, but we will give you some antibiotics to treat group beta strep. At 38 weeks, we start, some providers start a little sooner. It depends on what's going on. If my patient's 36 weeks and she tells me that she's contracting, we go ahead and check her cervix. So we want to perform a cervical exam and we check for cervical dilation. If If you want us to, and it's up to you, then we'll strip your membranes. But we'll ask you if you would like for us to strip your membranes. And some people do, and some people don't, and it's your choice. At 40 weeks gestation, if you're still pregnant, then we'll perform a non-stress test in the office, and that's just to make sure that your baby is healthy and is doing well inside. If we see any complications on the NST, we will send you to labor and delivery. And if everything's fine, then we'll go ahead and schedule usually a post-dates induction of labor at around 41 weeks. So yes, and I like to tell my patients the weeks um, how far along they are pregnant. So usually at 4 weeks, at 16 weeks, you're 4 months. 20 weeks, you're 5 months, like the beginning of the fifth month. I had a patient today, she was 20 weeks and 5 days. So I was like, well, you're 5 months and 5 days. So that let her know that she had to go all the way to the end of the fifth month. And then at 24 weeks, she would be 6 months. 28 weeks, you're 7 months. At 32 weeks, you're 8 months. At 36 weeks, you're 9 months. And then 40 weeks, it's the end of the ninth month. Some patients are like, that is 10 months. But yes, the end of the ninth month. So you're 40 weeks. It's 40 weeks in the pregnancy. And if you're still pregnant, everything is fine. Like I said, usually we induce you at 41 weeks. Sometimes we induce you a lot sooner, a lot earlier. It just depends on what's going on with your pregnancy. I also think it's important to let everyone know each pregnancy is so different. Like your first pregnancy that you have, you may say, oh my gosh, nothing like this ever happened. My baby, I didn't have any complications, or I didn't have any nausea or vomiting, or each pregnancy is so different. Each kid is so different. Each baby is so different. We're all different, and it's okay. So just know that it's okay. To have a little difference in between each pregnancy. So, what to expect after delivery, postpartum? So, we get through the 9 months, we have the baby, say 38 weeks, we go into labor and delivery, we are fine, everything works out, we have a nice, healthy baby, we have a vaginal delivery or a C section, but we have a healthy mom and a healthy baby. Woo, very good. Now, postpartum. So nobody ever tells you about everything that goes on postpartum when you have a baby. It's a lot. Your emotions are all over the place. It's a lot going on, a lot to figure out. But yes, through the grace of God, we'll get through it. Um, we want you to follow up with, of course, a friend health pediatrician in 2 to 3 days after you have your baby. And usually at the hospital, they're pretty good about facilitating that and helping you get that appointment. So that appointment is so very important. It lets the pediatrician know like how the baby's weight is, how the baby's gaining weight appropriately, if they're eating appropriately. And Dr. Vias is shaking his head. I love it. Yes, so kudos to our pediatric department. They do a very good job. If you're breastfeeding, they will provide you with information for lactation support. At the University of Chicago, they have the Baby Bistro, and they have lactation support. They have lactation consultants that are there. They're phenomenal. And I worked with those ladies for many years there at the hospital, and they are just amazing and vitally important. They have Baby Bistro, and I help to facilitate that. I love it. Baby Bistro, they usually have it on Wednesdays. They used to now. Wednesdays, and I think now it may be virtual, but if you have any problems or concerns, the lactation consultants can consult with you, and it's usually a group setting, and it is very helpful for moms because if I'm having a problem, I may say, hey, my nipple is inverted, or I had a little crack, or had a little bleeding, or it's tugging, or my baby's not latching on appropriately, and they can help you like figure it out. Like, it's amazing. Also, like sleeping is very important. Sleep habits for babies. The pediatricians will let you know what's normal and what's not. And the pediatricians are actually going to have a lunch and learn, and they will let you know all of the particulars, all the ins and outs on what you should expect after delivery with your newborn. So we're just recapping that a little bit today, but they will actually go into a lot more detail on what to expect after your delivery. Also, bleeding complications. We will go over that at your visit. So, what to expect at your visit, and we call the 6 Bs. So, we will check your blood pressure. Some patients develop what we call preeclampsia. And preeclampsia is a condition of pregnancy, or sometimes it can occur after the pregnancy. And it's very serious. It's related to high blood pressure. Can also have kidney or liver, even liver involvement. But we actually do a very good job of checking you for this. So, ladies, when we check that urine, it's for a reason. It's very important. When we check your blood pressure, it's very important. If we suspect you have any, we tell you the signs and symptoms. If you have any blurry vision, if you have any severe headaches, if you are having any shortness of breath, go to the hospital. This is cut and dry. It's very simple. We want you to go and get checked. It's very important that we know exactly what's going on with you and your baby. It can lead to seizures. It can lead to a stroke. I've had, I've seen over my course of years, several women have a stroke from preeclampsia. It is very, very serious. So we want you to take it seriously. We don't want you to be paranoid, but we want you to be aware of what's going on with your body. If you have a lot of swelling, let your provider know when you come in for your visit. Or if you have any concerns, go to labor and delivery. They will take good care of you. We check your bleeding at your postpartum visit. We'll ask you about your bleeding. How much bleeding did you have after delivery? If you've had a period, we'll ask you about breastfeeding. We'll ask you, we call it baby blues or depression. Postpartum depression is real. We will give you a depression scale. It's the Edinburgh Depression Scale. That's the scale that we use. Also, your pediatrician at the second or third day's visit, they will also give you the same screen. So please be honest on your depression scale. And it's real, and we want to know about it. We want to help you get